When we make the decision to transfer to the hospital from the birth center, generally speaking, it's not for anything that is any type of an emergency. And we make that decision as a team, and that team includes your midwife and the family. And it's not something that is just made by the midwife and the midwife says we're going. A lot of times it's a conversation and we're kind of chatting about, the options that we have here. Most of the time we're transferring for things like a really long, prolonged labor and mom is just tired, her contractions are spacing out. And so we're having that conversation of, okay, let's try this and this here, but if this isn't working, then maybe sometimes it's time to go and get something like an epidural, just simply because mom's body is so tired that an epidural is the perfect thing to get at that point to allow her body to continue working, but her brain to also rest. And sometimes there are certain positions that are a little bit difficult for mom to get in when she is feeling everything, that we can get her in when she's a little bit more comfortable, that will allow the baby to rotate if we can't get the baby to rotate here. So once we agree that transferring is the appropriate thing to do, then we'll get an IV started here. Unless mom already has one, we'll draw some blood work that they would draw at the hospital, just so it's already done and they're not having to poke mom again when we get there. And then also it allows us to get IV fluids started, so then that way when we do get there, if they are wanting an epidural, that process can happen a little bit quicker because they're already getting that fluid bolus that they need for the epidural. And then we, as the provider, we go ahead and call MUSC, we call head and say, hey, this is what's going on. We're going to be bringing a patient, and then we kind of pack up our stuff, you guys pack up your stuff, and then we kind of carry it. You get in your car, we get in our car, we just kind of tailgate down to MUSC. When we get there, we go up to labor and delivery, and then we just check in at the front desk. They tell us what room we're going to, and then we kind of get you settled. We'll kind of turn you over to the nurse at that point. She'll get you on the monitor, get you settled, ask you a bunch of questions, admission questions that they need to. We put orders in, and then write like a history and physical, like an admission note, and then we carry on from there and hopefully have a vaginal birth, and you'll meet your baby soon, essentially. On the off chance, or very rare chance, that it is more of an emergent situation, whether it be for something like the baby's just all of a sudden not tolerating things very well, or mom's bleeding a lot for some reason, whether it be before baby or even after baby, and we've done all the things and we can't get it to stop, or just some other emergent situation, then we will call 911. And again, we'll, if you don't already have an IV, we'll get an IV started. And while we're waiting for EMS to get here, just because at that point we've deemed that it's not safe for mom to travel in her own private car, we would rather ride together, and EMS is the easiest and quickest way to do that. Then we'll go ahead and call MUSC while we're waiting for EMS, get your IV in, pack you guys up, and then as soon as EMS gets here, then mom and the midwife will hop in the back of the ambulance with the EMS crew, and then dad or her partner will go ahead and follow us down to MUSC. And then we just call ahead and they're ready for us. And then depending upon what the situation is, a lot of times if we're going in a true emergent situation, if it's before the baby is born, a lot of times we are going because the baby needs to come out sooner rather than later. And so we will turn your care over to the OB team at that point, and then proceed to the OR if that's something that we need to get the baby out via C-section, if the baby's telling us the baby needs to come out sooner rather than later. And we will generally stay right with you and come into the OR with you, and then be there to kind of help answer any questions and facilitate your care and make sure that the OB team knows all about you as a new mom and kind of what has happened and transpired during your labor or prior to that admission and need to be transferred.